Hi, good morning. I'm Dr. Vissio from Briar Animal Hospital, and here today to answer some questions about cat spaying and neutering, hoping that we can get you a better understanding about why this topic is so important.
Dr. Vissio, what is cat neutering?
So neutering is a general term that can refer to either spaying or neutering, which involves removing the reproductive essentials of your pet so that they cannot reproduce. So for a male cat, that will involve removing the testicles, and for a female cat, that involves removing the ovaries and the uterus.
How does spaying or neutering impact the health and well-being of my cat?
So we take extra precautions to try and time the occurrence of this procedure to minimally impact health. The goals are really to improve health and to minimize complications that can happen from remaining and maintaining those organs if they're not being used. So we usually like to wait until pets are at least 6 months old so that they do have those hormones that help drive growth, bone development, organ development, all of those very important things. But then once they reach sexual maturity, then we talk about removing them so that they later on don't develop cancers. So cancers, ovarian cancer, mammary cancer are the most common in cats. We also have a very high incidence of pyometra, which is an infection of the uterus. Those can all be life-threatening. And then in males, they are very prone to spraying around the house, having urinary issues, having aggressive tendencies, trying to get out of the house, search for females. All of these things can be quite destructive if they cannot achieve their goals. So neutering them has many health benefits. We really don't see, there's been research over many, many years, significant, let's say, deterrence or adverse health effects by spaying and neutering, especially in cats. In dogs, there's some argument for urinary incontinence that can be seen that seems to be hormone related. And again, that tends to be related to the time of neutering or spaying in females, which is again why we follow the national guidelines about how and when to spay and neuter to make it safe as possible.
How soon should I bring my cat in to see a veterinarian to get them spayed or neutered?
So we recommend an establishing exam as soon as you get your pet, just basically to try and catch things early on. So when they're a young kitten, we also start vaccines at that time to make sure that they don't get any infectious diseases. And that way that gives us plenty of time to talk through any questions or concerns you have about spaying and neutering. And so we will tailor this to your specific pet. There certainly are some fancy breeds of cats that we may discuss being a bit more cautious, maybe doing additional testing for heart disease, or that if they do have any breed specific disease processes that may be affected by spay or neutering, we take that into consideration for each individual and may recommend a later time.
How will spaying or neutering affect my cat's behavior?
So overall, spaying and neutering typically shouldn't affect their behavior too much. Females, we really don't see too much behavior besides the behavior that they exhibit when they go into heat. So they won't go into heat, they won't have those behaviors, of nesting, being very clingy or being very standoffish or having dramatic behavioral changes related to hormones. So if you've experienced that, that would go away. But otherwise, personality changes we really don't see. We go to great lengths to try and minimize the stress of the visit here, so that's not something that sticks with them. As far as males go, so testosterone being around for a very long time, there are certain behaviors that can be learned. So like spraying, so the earlier you do that, safety-wise, the better. But typically you will have less, let's say, spraying aggression, trying to leave the house, trying to search for females, those are all tend to be driven by hormones. So if there's less drive for that, you may get improvement. If they've had those hormones for many years and then you neuter them, again, at that time it can become learned. So you might not get complete resolution if you're trying to use neutering as a way to completely change behavior.
My last question is, how should I care for my cat before and after spaying or neutering?
So about the same, but just generally around the time that they're spayed or neutered, because it is a surgery, you do want to be extra careful. We're going to recommend, if they're not already inside, keeping them inside for a few days before, and then the 2 weeks after they have the procedure. It's really important to keep that incision clean and dry, and that they have an e-collar on, like a cone, to help prevent them from licking the incision. We really try to minimize the use of antibiotics. They're not a great thing to have to use, and generally speaking, surgery is so aseptic and so clean that if they are not able to lick that incision, the chances of it getting infected are fairly low, as long as they're in a hygienic environment. They do usually stay here for the day. They're dropped off in the morning. They go home later that day after we've made sure that they've recovered from anesthesia, that their pain is well controlled. They're usually very sleepy for the rest of the day. Sometimes into the morning. They may not want to eat as much at night, so we recommend offering them very small meals. Usually by the next morning to midday, they should, all of the anesthesia should be completely worn off. And they should be back to their normal energetic selves. That's also a time to check in with us, make sure you feel like their pain is well controlled. We always send them home with that. Some pets may be a little bit more anxious with the cone on, so that's something that's good to communicate with us as well. Sometimes we can anticipate that ahead of time to make sure that they are able to rest. Stress is not good for healing, so we try to minimize that as much as possible. And then really the incision, no matter if it's small or large, surgeons at various hospitals have different techniques, but incisions heal end to end, so it usually only takes that 10 to 14 day period. Then we get you in, recheck the incision, so not only we can feel like your pet has healed, but that you can feel confident that you can let them run wild again, that cone can come off, and that there's minimal to no risk from that point moving forward. All right, I think those are all our questions for today. As always, feel free to go through our resources, let us know if you have any other questions, but I hope that this has been helpful to you. Take care.